And we are live. It's Dr. J here in the house. Today, we're going to be talking about the top 5 nutrients recommended by functional medicine doctors. This will be a live Q&A, so if you guys want to come in, any questions, I'm happy to answer them as we go, especially if they're relevant. So I get this topic all the time. It's kind of a loaded topic because really, there's going to be kind of top 5 nutrients that, let's just say, generally we see people need more of. And that's kind of a trend, if you will. But there'll also be things that, are going to be more fine-tuned and specific based on actual lab testing, right? Lab testing is obviously the better way to do it because you're going to be able to figure out exactly what you need as an individual, which is more important. But then there's general trends. So we'll kind of go into that, right? So the average person coming to see me, there's going to be some kind of a chronic gut issue. So a lot of times they're not making enough stomach acid, enough enzymes. They're going to be nutrient deficient in certain key nutrients. I'll tell you out of the gate. Nutrient number 1 is magnesium. Magnesium gets burnt up when we're under stress. It gets burnt up when we're consuming excess carbohydrates. It gets burnt up when we get exposed to toxins, poor sleep. So these nutrients, if we are not managing our body and we're under undue stress, they're going to go up. The demand goes up. Therefore, those nutrients in our body go down. And if we don't get them in our diet via the food that's coming in, then that's also going to create another bottleneck and drop that. So magnesium out of the gate will be important. Now, if we have an inflamed brain, magnesium is vitally important to help with inflammation in the brain, right? There's a couple different kinds of magnesium. We could have magnesium citrate, like in a natural calm, that's maybe more of a laxative, but still can increase your magnesium levels well. More of a laxative magnesium, like a magnesium oxide is one. We'll use it more for motility, kind of getting the gut moving better. And then we're going to have things like a magnesium malate or a glycinate that'll plug more into the mitochondria and the Krebs cycle, still have really increase your red blood cell magnesium levels sufficiently without as much magnesium, typically 2 to 3 times more potent than, like, let's say, a citrate. You may need like 500 milligrams to a solid gram, but you may only need 2 to 400 on that for a glycinate or a malate. And then we have things like an aspartate, which is in that same kind of camp, or even a magnesium threonate, which is going to cross the blood-brain barrier. That's a magnesium discovered at MIT, and they've used that to really increase magnesium levels in the brain. Really helps when you have a lot of inflammation in the brain, get that inflammation down. Magnesium is a powerful anti-inflammatory, so really good there. So magnesium is going to be key, lots of different types. I like a red blood cell magnesium test. We could also do a magnesium serum on a blood test. 2 or higher is good, but that may not be enough to tell the whole story. Next, I see a lot of thyroid patients. I see a lot of people that have thyroid antibodies and thyroid inflammation. So guess what my next nutrient is going to be? Selenium. Selenium is an important mineral cofactor for glutathione. So glutathione, really important, made by the liver. It's going to be an important, powerful endogenous antioxidant. It's going to help buffer toxic load. It's going to help with hydrogen peroxide neutralization, right? So selenium is an important cofactor for glutathione. Selenium will take that hydrogen peroxide that's made in the iodination process. So iodination is simply, we have a sodium iodine symporter, brings iodine into the thyroid gland. The iodination process involves a deiodinase enzyme made from the liver, selenium based, that will help take the tyrosine protein molecule and then bind it to 4 molecules of iodine to make T4. The number 4 is indicative of how many iodine molecules there are. And then there'll be an activation of that where they'll cleave a 4th iodine, making it 3 on the thyroid. So now you're down to T3. You have 3 molecules of iodine bound to the tyrosine. So that activates your thyroid hormone. T3 is 300% more metabolically active than T4. So pretty cool. Now in that process, we spit off a lot of hydrogen peroxide though with the iodination. So if we have a lot of antibodies present, guess what? The iodination and the hydrogen peroxide can provoke autoimmune issues. So getting the selenium in there converts the hydrogen peroxide to water. It takes away an oxygen molecule, and now we have water instead. So very powerful for reducing thyroid inflammation and attenuating thyroid antibodies. Next, zinc's really important. I like zinc. It has a lot of benefit for immune function. We heard about it a few years ago when some bugs were going around. Zinc can be very helpful for immune. We have zinc lozenges, great for throat inflammation. Zinc is an important cofactor for many sex hormones. We see it in guys for testosterone. With women, it can be vitally important as well. It's also it activates your genes. They're what's called genetic zinc fingers, and it has a major epigenetic impact on your body. Zinc's also vitally important for your libido, for hair. It's part of the reason why you see things like oysters. They kind of have an aphrodisiac effect because of the high levels of zinc in them. So we love zinc. We want maybe an extra, the RDA is about 10 milligrams a day. You can get that in one oyster. Pretty cool, right? Now, we want about 25 to 30 milligrams a day. So, choosing healthy animal foods are going to be the best source. You'll get it in some vegetables. Pumpkin seeds are a rich vegetable source as well. All right, so we have zinc, we have selenium, we have magnesium. I would also say CoQ10 is very important as well because CoQ10, one, if you're on a statin, you're going to deplete your CoQ10 level. So you may not have as much CoQ10 if you're on a statin. As you get older, that mevalonic acid pathway that's activated by the HMG-CoA reductase enzyme, that pathway gets depleted as we age in regards to making CoQ10. So we typically see CoQ10 production over time go down. So that's real. And so getting more CoQ10 can be very helpful, especially if you have any cardiovascular inflammation or cardiovascular stress. That supports ATP production, good, healthy pumping, stroke volume of that heart. If you're into exercise or any cardio, you want good, healthy CoQ10. We'll run organic acid testing, and we'll look at CoQ10 levels all the time. There's a couple different markers. Hydroxymethylglutarate's a big one. There's a couple of markers on that organic acid. Markers 29 through 33 are going to be really profound at looking at CoQ10. I frequently see them low. So CoQ10 is really important for cardiovascular. And guess what? CoQ10 also is shown to help reduce thyroid antibodies too. So love that because thyroid is the most common autoimmune issue that I see in my practice. Okay, so we have CoQ10, we have selenium, we have magnesium, we have zinc out of the gate. I would say the next one is because I see a lot of people with chronic gut issues, and the gut tends to be the window where most autoimmune issues start. Hydrochloric acid. Not really a nutrient, but we need it. I mean, it is kind of made out of trimethylglycine, so that's an important nutrient for the brain, for glycine, gut lining, a little bit of glutathione there, but it's going to help bring that pH down, increase that acidity in the gut, activate our proteolytic enzymes, start with digestion, getting our proteins broken down better, our minerals ionized. Yes, all the minerals we talked about, they need good ionization, good acids. Now, again, supplements I'm recommending ideally will be in a better chelate. So if there's less acid, well, they're going to be chelated, so you'll still absorb them well, but we want to get more nutrients out of your food. So good hydrochloric acid, anywhere between 1 gram to 3 grams is good, especially with pepsin in there. And we want to take that with food. We want to calibrate that and make sure that we can tolerate it and we're not creating gastritis, or if you already have an atrophic gastritis, a thinned out gut lining, we want to make sure we dial that in and we don't over irritate the gut. Hope that makes sense. I see a lot of patients in my practice that have thyroid issues, hence a lot of the thyroid nutrients. A lot of people who are stressed out, who have heart rate, heart rhythm issues. They're stressed. They have a hard time relaxing and sleeping. So I want to really look at some of these nutrients. Autoimmune plays a big role. Glutathione plays a big role, especially with your immune system. So if you have deeper issues you want to dive in on, you have questions, put them in the comments. I'll be responding here personally. And if you want to dive in deeper, you have issues with some of these nutrients or some of the underlying root issues that are driving them, reach out down below. There'll be a link where you can reach out and schedule with my team. We're happy to help you out, CPC patients worldwide, with all of these issues. All right, guys, hope you enjoyed this video. If you do, let me know in the comments below. Subscribe and make sure you hit the bell for notifications. Take care. Bye now.